Chapter 8, Female Reproductive System. Understanding the singular and plural forms of medical terms is a fundamental skill for students in healthcare. Let's explore some examples to illustrate this concept. Labium, the singular form, meaning lip. Its plural form is labia, referring to the lips or folds of the vulva. Majus, the singular term for greater. The plural form is majora, describing the outer folds of the labia. Minus, the singular term for smaller. Its plural form is minora, referring to the inner folds of the labia. Knowing these singular and plural forms helps students interpret and use medical terminology accurately in both written and spoken communication. Let's discuss ovaries, uterine tubes, and uterus. Oogenesis, the process of egg formation, occurs in the ovaries and is essential to female reproduction. Let's use the figure to explore the stages of oogenesis and the process of ovulation. Oogenesis begins with oocytes, which are immature egg cells. These oocytes undergo maturation within the ovarian follicles. During each menstrual cycle, hormonal signals stimulate the development of one dominant follicle, leading to the formation of a mature ovum. This mature ovum is ready for fertilization. Ovulation is the release of the mature ovum from the ovary. Typically, this occurs once every 28 days as part of the menstrual cycle. The released ovum enters the fallopian tube, where it may encounter sperm for fertilization. Oogenesis and ovulation are integral to the reproductive process. Female reproductive hormones play crucial roles in regulating sexual functions and the menstrual cycle. Let's explore the primary hormones and their functions. Estrogen stimulates the development of secondary sexual characteristics, such as breast growth and the distribution of body fat. This hormone promotes the growth and maintenance of the uterine lining during the first half of the menstrual cycle, preparing the body for potential pregnancy. Lastly, estrogen contributes to overall reproductive health by maintaining the vaginal lining and regulating bone density. Progesterone prepares the uterus for implantation of a fertilized egg by thickening the endometrium. This hormone maintains the uterine environment during pregnancy and helps regulate the menstrual cycle by balancing the effects of estrogen. Understanding and defining abbreviations is a fundamental skill in healthcare and science. Let's review some key abbreviations related to the reproductive system. FSH stands for follicle-stimulating hormone. This hormone, secreted by the pituitary gland, plays a vital role in stimulating the growth and maturation of ovarian follicles in females and the production of sperm in males. GnRH refers to gonadotropin-releasing hormone. This hormone, produced by the hypothalamus, signals the pituitary gland to release both FSH and LH, initiating and regulating reproductive processes. LH means luteinizing hormone, another hormone secreted by the pituitary gland. LH is essential for triggering ovulation in females and stimulating testosterone production in males. The sexual cycle is a carefully regulated process that typically spans approximately 28 days. It involves coordinated changes in the ovaries and uterus, driven by hormonal fluctuations. Let's break it down and use the figure to illustrate the uterine cycle. Menstruation. This is the shedding of the endometrium, or uterine lining, which occurs during the first 3 to 5 days of the cycle if fertilization does not occur. Ovulation. Around day 14, a mature ovum is released from the ovary, marking the midpoint of the cycle. This phase is crucial for potential fertilization. The ovarian hormones, estrogen and progesterone, regulate the uterine cycle by preparing the endometrium for a possible pregnancy. Estrogen stimulates the rebuilding of the uterine lining during the first half of the cycle. Progesterone, secreted after ovulation, thickens the endometrium to support implantation of a fertilized egg. Let's define some important terms. Follicle is a spherical mass of cells containing a cavity located in the ovaries. It surrounds and nurtures the developing oocyte during its maturation. Involute, as this term means to decrease in size. For example, after ovulation, the ruptured follicle involutes to form the corpus luteum, or eventually becomes a scar-like structure called the corpus albicans. Ovulate is the release of an oocyte from a follicle. This occurs around day 14 of the sexual cycle, marking a critical point for potential fertilization. Defining and understanding these terms lays a solid foundation for comprehending the processes and structures involved in human reproduction. Let's discuss the disorders of the female reproductive tract. Sexually transmitted diseases, or STDs, are a significant public health concern, with 15 million cases reported annually in the United States. Let's review some common STDs, their symptoms, diagnosis, and treatment. Chlamydia is often asymptomatic, making it difficult to detect without testing. It is diagnosed by testing a swab from the cervix in females or the urethra in males. Treated effectively with antibiotics. Gonorrhea is caused by a bacterial infection and may also be asymptomatic. Symptoms can include vaginitis, urethritis, bleeding, and dysuria. It is diagnosed by testing a swab from the affected area and treated with antibiotics. Syphilis is caused by a spirochete bacterium that can spread through the bloodstream to other organs. The first sign may be a chancre, a painless sore at the site of infection. This disease requires prompt diagnosis and treatment with antibiotics to prevent systemic spread. Chancroid is an ulcerative disease resembling syphilis but without systemic effects and is successfully treated with antibiotics. Trichomoniasis is a parasitic infection that is often asymptomatic in males but causes a frothy, yellow-green discharge in females. Also known as a ping-pong infection. Molluscum contagiosum is a viral illness that causes small, shiny bumps, which can appear anywhere on the body. Although not always sexually transmitted, it's important to address promptly for proper management. Understanding the risks and consequences of certain infections is essential for promoting reproductive health and overall well-being. Pelvic inflammatory disease occurs when untreated infections, such as chlamydia or gonorrhea, ascend into the female reproductive organs. PID can lead to infertility, chronic pain, or ectopic pregnancy if untreated. Genital herpes is caused by a virus that leads to blister-like, painful genital sores, fever, joint pain, and tender, enlarged lymph nodes. While there is no cure, antiviral medications can manage symptoms and reduce transmission. Human papilloma virus causes genital warts in both men and women. In women, HPV can lead to changes in the cervix that increase the risk of cervical cancer. HPV infections can be prevented through immunization, a critical step in reducing cervical cancer risk. Human immunodeficiency virus is responsible for causing acquired immunodeficiency syndrome, also known as AIDS. HIV is carried in body fluids and is transmitted through unprotected sex, sharing needles, or from mother to child during childbirth or breastfeeding. Symptoms may not appear for years after infection, allowing the virus to silently damage the immune system. HIV is diagnosed through ELISA and Western blot blood tests. HIV weakens the immune system, leading to opportunistic infections that can be fatal without treatment. Awareness and prevention are key. Regular testing, safe practices, and vaccination where applicable can significantly reduce the risks associated with these conditions. Early detection and treatment are essential for managing these infections effectively. Accurate spelling of medical terms is a critical skill for healthcare students, as even small errors can lead to misunderstandings or mistakes in patient care. Let's review some key terms and their correct spelling. Chancre, C-H-A-N-C-R-E, refers to the painless sore that may appear as the first sign of syphilis. Gonorrhea, G-O-N-O-R-H-E, a bacterial infection that can affect the reproductive and urinary tracts. Papilloma, P-A-P-I-L-O-M-A, a growth caused by the human papilloma virus, HPV, often associated with genital warts. Syphilis, S-Y-P-H-I-L-S, a sexually transmitted infection caused by a spirochete bacterium. Let's discuss two significant ovarian conditions, their causes, and their treatments. Polycystic ovarian syndrome, or PCOS, involves the formation of multiple follicular cysts, fluid-filled sacs in both ovaries. This condition disrupts normal ovulation, often leading to the absence of ovulation and ultimately the absence of menses. PCOS can also cause symptoms such as hormonal imbalances, irregular menstrual cycles, and fertility challenges. Ovarian cancer is the most common gynecologic cancer after endometrial cancer. Often diagnosed at advanced stages, it requires prompt and aggressive treatment. Treatment typically includes surgery to remove the cancer and affected tissues, followed by chemotherapy to target remaining cancer cells. Understanding the terminology and conditions related to menstruation and gynecologic health is essential for healthcare students. Let's explore some key terms and their definitions. Amenorrhea is the absence of menses. Primary amenorrhea occurs when menstruation has not begun by age 16. Secondary amenorrhea refers to the absence of 3 or more menstrual cycles in a woman who previously menstruated normally and is not in menopause. The most common cause is pregnancy. Dysmenorrhea refers to painful or difficult menstruation. Premenstrual syndrome, or PMS, is pain or discomfort occurring in relation to menstruation, including physical and emotional symptoms. Secondary dysmenorrhea is associated with underlying disorders, such as endometriosis or genital tract infections. Endometriosis is a condition in which endometrial cells normally found inside the uterus become implanted outside the uterus. This can lead to cysts, scar tissue, and chronic pain. The exact cause of endometriosis remains unknown. Uterine prolapse occurs when the uterus sags or slips from its normal position, often due to weakened pelvic floor muscles or ligaments. Recognizing and understanding these conditions helps build a foundation for diagnosing and managing reproductive health issues. Encourage regular gynecologic checkups to address concerns early. Gynecological health encompasses a wide range of conditions and processes, each with unique implications for a patient's well-being. Let's explore some important topics. Uterine fibroids are non-cancerous growths appear during the childbearing years and can cause symptoms such as heavy menstrual bleeding, pelvic pain, frequent urination, or even difficulty conceiving. Dysfunctional uterine bleeding, or DUB, refers to excessive or irregular bleeding with no identifiable cause, often presenting as menorrhagia. Endometrial polyps growths in the uterine lining can also lead to abnormal bleeding. Menopause is diagnosed when a woman has not menstruated for a year and is not pregnant. This natural process marks reproductive aging as estrogen and progesterone levels decline, often accompanied by symptoms such as hot flashes, mood swings, and vaginal dryness. Endometrial cancer is the 4th most common cancer in women. The most frequent symptom is vaginal bleeding after menopause, warranting prompt medical evaluation. For cervical cancer, although less common, 50% of cases occur in women between ages 35 and 55. Early cervical cancer may be asymptomatic and is often detected through routine Pap tests. HPV infection is a significant risk factor, highlighting the importance of vaccination and regular screenings. Salpingitis is an inflammation of the fallopian tubes, often resulting from an ascending bacterial infection, such as an STD. Scarring from salpingitis is a leading cause of infertility, emphasizing the need for early diagnosis and treatment. Infertility is a deeply personal and often challenging experience for many individuals and couples. It is defined as the inability to become pregnant after 1 year of unprotected intercourse. There are several potential causes of infertility, including infrequent ovulation, which may result from hormonal imbalances, scarring of the fallopian tubes, often caused by infections or conditions like salpingitis, and structural abnormalities of the uterus, such as fibroids or congenital malformations. Diagnosing infertility requires a comprehensive approach to identify potential issues. Common diagnostic methods include hormone blood levels, hysterosalpingogram, ultrasound of the uterus, laparoscopy, and postcoital testing. Hormone blood levels is to assess reproductive hormones like FSH, LH, and progesterone. Hysterosalpingogram is an X-ray to evaluate the uterus and fallopian tubes. Ultrasound of the uterus is used to detect structural abnormalities. Laparoscopy is a minimally invasive procedure to examine the reproductive organs directly. Postcoital testing is to analyze cervical mucus and sperm interaction after intercourse. Treatment options depend on the underlying cause and may include treating any underlying condition, intrauterine insemination, and in vitro fertilization. Let's discuss the procedures and pharmacology in gynecology. Gynecological diagnostic procedures provide critical insights into reproductive health. Let's explore more diagnostic tools and their applications. Hormone blood levels tests measure levels of progesterone, estrogens, and follicle-stimulating hormone, FSH, to assess ovarian function and menstrual irregularities. Hysterosalpingogram, or X-rays of the uterus and uterine tubes, are taken after injecting a dye. This procedure identifies blockages or abnormalities that could affect fertility. Abdominal ultrasound provides imaging of the shape and size of the uterus to detect abnormalities or monitor conditions like fibroids. Laparoscopy is a minimally invasive procedure using a laparoscope to directly examine the uterus, fallopian tubes, and ovaries through a small abdominal incision. This is particularly useful for diagnosing endometriosis or pelvic inflammatory disease. Postcoital testing examines the cervix shortly after unprotected intercourse to determine if sperm can travel into the uterus, helping diagnose infertility. Pap test screens for cervical cancer by examining cells from the cervix under a microscope. This test is highly effective for early detection of abnormalities. Screening guidelines recommend every 3 years for women aged 21 to 29, every 5 years for women aged 30 to 65 when combined with HPV testing. Pelvic ultrasound uses sound waves to create images of the pelvic organs, such as the uterus and ovaries, offering a non-invasive method to evaluate reproductive health. These diagnostic procedures are invaluable for early detection, accurate diagnosis, and effective treatment planning. Regular screenings and open communication with healthcare providers are key to maintaining reproductive health. Gynecological therapeutic procedures are critical in treating abnormalities, managing conditions, and preserving reproductive health. Let's review some common procedures and their applications. Conization is a cone-shaped piece of tissue is removed from the cervix, typically surrounding an abnormality, for diagnostic or therapeutic purposes. Loop electrosurgical excision procedure is a wire loop carrying an electrical current is used to slice and remove abnormal cells from the cervix. Laser surgery is a laser beam targets and destroys precancerous and cancerous cells, offering precision with minimal damage to surrounding tissue. Cryosurgery uses freezing techniques to kill precancerous and cancerous cells, often employed for conditions affecting the cervix. Dilation and curettage is where the cervix is dilated to allow for the scraping or suctioning of the uterine lining, often to collect tissue samples or treat abnormal bleeding. Endometrial ablation removes a thin layer of the uterine lining to treat heavy menstrual bleeding. Hysterectomy is surgical removal of the uterus. Oophorectomy is the surgical removal of one or both ovaries, often performed to treat ovarian cancer, cysts, or other disorders. Colporrhaphy is a surgical repair of the vaginal wall, often performed to correct conditions like a cystocele or rectocele. Each of these procedures plays a vital role in addressing gynecological health concerns. Open communication with healthcare providers helps ensure the right treatment plan is selected for individual needs. Salpingectomy is the surgical removal of one or both fallopian tubes, often performed for conditions like ectopic pregnancy or fallopian tube cancer. Tubal ligation is a permanent procedure for preventing future pregnancy, where the fallopian tubes are cut, tied, or sealed to block the path of the egg. Myomectomy is a surgical procedure to remove fibroids while leaving the uterus intact, preserving fertility and uterine function. Expectant management is a strategy of watchful waiting, monitoring the condition without immediate intervention, often used for small fibroids or early pregnancies. Hormone therapy uses GnRH agonists to lower estrogen and progesterone levels, stopping menstruation and causing fibroids to shrink. This can be a temporary or pre-surgical treatment. Intrauterine insemination is a fertility procedure in which sperm are inserted directly into the uterus using a specialized catheter, increasing the chances of fertilization. In vitro fertilization is a process where egg and sperm are combined in a laboratory dish to create an embryo, which is then placed inside the uterus to achieve pregnancy. Understanding the meaning of commonly used medical terms is essential for students preparing for careers in healthcare. Let's define a few key terms. Ablation refers to the removal of tissue to destroy its function. This is commonly used in procedures like endometrial ablation, where the uterine lining is removed to treat heavy menstrual bleeding. Curettage, the scraping of the interior of a cavity, often used in procedures like dilation and curettage to remove tissue from the uterus for diagnostic or therapeutic purposes. Dysfunctional means having difficulty in performing. In medical settings, this term is often applied to conditions like dysfunctional uterine bleeding, indicating abnormal or irregular menstrual cycles. Medical abbreviations serve as a vital shorthand in healthcare settings, enhancing efficiency and clarity. Let's identify some commonly used abbreviations. D&C stands for dilation and curettage, a surgical procedure to scrape or suction tissue from the uterine lining for diagnostic or therapeutic purposes. DUB refers to dysfunctional uterine bleeding, describing abnormal or irregular uterine bleeding without an identifiable cause. LEEP is short for loop electrosurgical excision procedure, a treatment that uses a wire loop with an electrical current to remove abnormal cervical tissue. PAP refers to the Papanicolaou test, named after Dr. George Papanicolaou, a Greek-American cytologist. The PAP test is a critical tool for early detection of cervical cancer. Familiarity with these abbreviations ensures students can effectively interpret medical documentation and communicate accurately in clinical environments. Practice is key to mastering this essential skill. Pharmacological agents are essential tools in managing gynecological disorders and improving patients' quality of life. Let's review some key treatments. Hormone replacement therapy involves medications that replace diminished circulating estrogen and progesterone hormones in women experiencing menopause. This therapy helps relieve menopausal symptoms, such as hot flashes, mood swings, and vaginal dryness, while also supporting bone health. Effective pharmacological agents target specific sexually transmitted diseases. Metronidazole treats trichomoniasis, a parasitic infection. Azithromycin is used to combat chlamydia, a bacterial infection often asymptomatic but potentially harmful. Cefixime targets gonorrhea, a bacterial STD that may cause urethritis or vaginitis. These pharmacological agents are vital for managing gynecological conditions and infections effectively, which ensures proper diagnosis and adherence to treatment regimens. Let's discuss obstetrics, pregnancy, and childbirth. Fertilization and early embryonic development are critical stages in the reproductive process. Let's use the figure to explore this journey. Fertilization is a process occurs when a sperm and ovum unite, typically in the fallopian tube. After ovulation, the ovum must be fertilized within 24 hours to survive. Fertilization results in the formation of a zygote, the single-celled organism that marks the beginning of new life. The zygote begins to divide and grow as it travels toward the uterus, forming a structure called a blastocyst. The blastocyst contains a fluid-filled cavity and an inner cell mass that will develop into the embryo. Once in the uterus, the blastocyst burrows into the endometrium. This process, known as implantation, secures the developing embryo and establishes the placenta to support growth. Pregnancy is a fascinating journey of development, marked by distinct stages and remarkable milestones. Let's use the figure to explore these stages, focusing on the embryo, placenta, and fetus, as well as the process of implantation. lasts from the 2nd to 8th weeks of gestation, during which the foundation for all major organs and body systems is established. By around 4 weeks of gestation, the embryo begins forming the brain, spinal cord, and an early beating heart. The placenta is vital for the baby's development, acting as a lifeline between the mother and baby. It transports nutrients, oxygen, wastes, antibodies, and hormones, ensuring the fetus receives everything needed for growth and development. Begins at the 9th week of gestation and continues until birth. This phase focuses on the growth and maturation of the baby's body systems. While full gestation is often considered 40 weeks, the baby is full term and ready for birth by 38 weeks. Most pregnancies result in singletons, one baby. However, multiple births can occur and are categorized as dizygotic twins, or fraternal twins, resulting from 2 separate eggs fertilized by 2 different sperm. Monozygotic twins, or identical twins that form from a single fertilized egg splitting into 2 embryos. The development of a baby during pregnancy is a remarkable journey, marked by distinct stages and supported by critical structures like the placenta. Let's review these stages and important terms associated with pregnancy. Lasts from weeks 2 through 8 of gestation. During this phase, the foundations for all major organs and body systems are established, making it a critical period in development. The placenta is a disc of tissue that grows throughout pregnancy and gives rise to the umbilical cord, connecting the baby to the mother. It serves as a lifeline, transporting nutrients, nitrogenous wastes, oxygen, and maternal antibodies to the developing baby. Additionally, the placenta secretes hormones that maintain pregnancy and support fetal development. Begins at week 8 of gestation and continues until birth. During this phase, the baby is referred to as a fetus, and the focus shifts to the growth and maturation of organ systems. By 38 weeks, the baby is considered full term and ready for life outside the womb. Gravida is the total number of pregnancies a woman has experienced, regardless of outcome. Parity is the number of pregnancies that resulted in live births or viable gestations. Abortus refers to the loss of pregnancy before the 20th week of gestation, encompassing miscarriages and elective terminations. Let's analyze some key terms in medical terminology by breaking them into their word elements and defining them. Embryo. Word elements. Derived from the Greek word meaning a young one. Definition. Refers to the first 8 weeks of human development. Fetus. Word elements. Derived from the Latin word meaning offspring. Definition. Refers to the developmental stage from week 9 through birth. Gravida. Word elements. Derived from the Latin word meaning pregnant woman. Definition. Refers to the total number of pregnancies a woman has experienced, regardless of outcome. Para. Word elements. Derived from the Latin word meaning to bring forth. Definition. Refers to the number of deliveries a woman has had that resulted in viable offspring. Pregnancy is supported by a complex interplay of hormones, each playing a crucial role in maintaining maternal health and fostering fetal development. Let's review the key hormones of pregnancy. Human chorionic gonadotropin secreted by the placenta and embryo. This hormone is critical in early pregnancy. It sustains the corpus luteum and is the basis for pregnancy tests. Estrogen stimulates uterine growth and breast enlargement, preparing the mother's body for childbirth and lactation. Progesterone produced by the placenta and the corpus luteum. It prevents ovulation and menstruation. Uterine muscle contractions, reducing the risk of preterm labor. Follicle-stimulating hormone released by the pituitary gland helps sustain the corpus luteum, which is essential in early pregnancy. Luteinizing hormone, also secreted by the pituitary gland, supports the maintenance of the corpus luteum, ensuring continued production of progesterone. Childbirth, or labor, refers to the entire process of expelling the fetus from the uterus. This transformative journey is divided into 3 stages. Let's use the figure to illustrate these stages. First, we have stage 1. The first stage is marked by the dilation and effacement, thinning of the cervix. Uterine contractions help the cervix open to about 10 centimeters, preparing for the passage of the baby. Next, we have stage 2. This stage involves the expulsion of the fetus from the uterus. It begins when the baby's head reaches the vaginal opening and ends with the birth of the baby. This is often referred to as the pushing stage. Lastly, we have stage 3. The third stage begins after the baby is born and involves the expulsion of the placenta, which detaches from the uterine wall. The puerperium, or postpartum period, lasts about 6 weeks after childbirth, during which the mother's body undergoes significant physiological changes. The uterus shrinks back to its pre-pregnancy size, a process known as involution. Hormones, such as estrogen and progesterone, decrease to pre-pregnancy levels. The cervix and vaginal tissues heal, and breastfeeding may begin as the body transitions to support the baby's nutritional needs. Childbirth and postpartum recovery involve specific processes and terms that are crucial to understand. Let's define these key medical terms to enhance clarity and comprehension. Crowning. The moment during childbirth when the baby's head becomes visible at the vaginal opening, signaling the imminent delivery. Dilation. The stretching or widening of the cervix, measured in centimeters, to allow the baby to pass through during labor. Effacement. The thinning and shortening of the cervix, which occurs in preparation for childbirth. Labor. The entire process of expelling the fetus from the uterus, involving uterine contractions, dilation, and effacement. Lochia. The postpartum vaginal discharge, consisting of blood, mucus, and uterine tissue, which occurs as the uterus heals. Puerperium. The 6-week postpartum period during which the mother's body recovers from childbirth, including the uterus returning to its normal size and hormonal adjustments. Let's discuss the disorders of pregnancy and childbirth. Pregnancy can involve complications and conditions requiring specialized care and attention. Let's explore some of these conditions. Ectopic pregnancy occurs when the zygote develops outside the uterus, most commonly in the fallopian tube. This condition is life-threatening and requires immediate medical attention. High-risk pregnancy can occur in mothers with pre-existing conditions or develop during pregnancy. A perinatologist, a specialist in high-risk pregnancies, provides care for these mothers. Preeclampsia, characterized by a sudden increase in blood pressure, proteinuria, and edema after the 20th week of gestation. Eclampsia is a life-threatening condition with symptoms of preeclampsia and the addition of convulsions, requiring urgent medical care. Amniotic fluid abnormalities include oligohydramnios and polyhydramnios. Oligohydramnios is insufficient amniotic fluid, which can lead to poor fetal growth and an increased risk of birth defects. Polyhydramnios is excessive amniotic fluid, often associated with preterm delivery. Gestational diabetes mellitus is a condition where insulin production decreases during pregnancy, requiring careful management to prevent complications for both mother and baby. Hyperemesis gravidarum is a severe nausea and vomiting that persist beyond the 12th week of gestation, potentially leading to dehydration and malnutrition. Childbirth involves various factors that can influence delivery outcomes. Let's review some critical conditions and fetal positions. Fetal distress occurs when the fetus experiences a lack of oxygen during labor, requiring immediate medical intervention to prevent complications. For a normal delivery, the fetus should present in the vertex position, meaning head first. Abnormal positions include breech, face, and shoulder. Breech is where the baby's feet or buttocks are positioned to deliver first. Face is where the face is positioned to deliver first. Shoulder is where the shoulder is positioned to deliver first, often requiring a caesarean section. Nuchal cord occurs when the umbilical cord wraps around the baby's neck, potentially restricting oxygen and blood flow. Prolapsed umbilical cord is a serious condition where the umbilical cord precedes the fetus in the birth canal, posing risks to oxygen supply and requiring immediate medical attention. Premature rupture of membranes happens when the amniotic sac ruptures before labor begins, increasing the risk of infection for both the fetus and the uterus. The timing of delivery plays a crucial role in the health and development of a newborn. Let's review the classifications of delivery timing and associated risks. Premature delivery occurs when a baby is born before 37 weeks of gestation. Premature infants face risks including respiratory distress syndrome due to underdeveloped lungs, apnea, characterized by pauses in breathing, jaundice, caused by immature liver function. Full-term delivery occurs between 37 and 42 weeks of gestation. Full-term babies are generally well-developed and have a significantly reduced risk of complications. Post-mature delivery refers to babies born after 42 weeks of gestation. Post-mature deliveries can pose risks, such as reduced amniotic fluid levels or complications during labor. Complications involving the placenta can significantly impact labor and delivery. Let's explore three key conditions: placenta abruptio, placenta previa, and retained placenta. Placenta abruptio occurs when the placenta separates from the uterine wall before delivery. It can lead to fetal distress and anoxia, lack of oxygen, posing serious risks to both the baby and mother. Placenta previa is where the placenta develops between the baby's head and the cervical opening, obstructing the baby's path during delivery. This often requires careful monitoring and may necessitate a caesarean delivery to ensure safety. Retained placenta occurs when the placenta is not completely expelled from the uterus after the baby's birth. This can result in postpartum hemorrhage, requiring medical intervention to prevent complications. Let's discuss the procedures in pharmacology. Obstetrics. Understanding the differences between similar words is crucial in medical terminology. Let's clarify two pairs of commonly confused terms for contraception and contraceptive. Contraception is a noun that refers to the prevention of pregnancy. Contraceptive is an adjective that describes something related to contraception, such as a contraceptive device or method. For ligature and ligation. Ligature refers to a thread or wire tied around a tubular structure, like a blood vessel or fallopian tube, to close it. Ligation is the process of using a ligature to achieve closure. Prenatal care includes a range of tests and procedures to monitor the health of the baby and mother. Let's explore screening tests, diagnostic tests, and therapeutic procedures. Chorionic villus sampling uses ultrasound guidance to insert a needle through the abdomen or a catheter through the cervix to obtain a sample of placental tissue. This test helps identify genetic conditions early in pregnancy. Cystic fibrosis screening is a blood test that determines if the gene causing cystic fibrosis is present. Ultrasound provides detailed imaging of the baby's organs and bones, allowing for the identification of potential abnormalities in utero. Amniocentesis uses ultrasound guidance to insert a thin needle through the abdominal wall into the amniotic sac. A small amount of amniotic fluid is removed to test for genetic conditions or other fetal health concerns. During labor, if electronic fetal heart monitoring indicates fetal distress, the use of forceps or a caesarean section can facilitate a timely delivery, ensuring the safety of both mother and baby. Let's discuss the breasts. The breast is a remarkable structure designed to nourish and support a newborn. Let's explore its anatomy and function using the figure to illustrate the parts of the breast. The breast is situated above the pectoralis major muscle and contains adipose tissue, lactiferous ducts, and suspensory ligaments. The breast consists of three main external parts: body, nipple, and areola. The body is the main portion of the breast. The nipple is the protruding part from which milk is released. The areola is the circular, pigmented area surrounding the nipple. During pregnancy, the mammary gland develops to support lactation and includes the following: alveoli, the structures that produce milk; lactiferous ducts, the tubes that transport milk to the nipple; lactiferous sinuses are small reservoirs at the base of the nipple that store milk prior to release. Lactation refers to the production and release of milk by the breast. The first secretion from the breast is colostrum, a protein-rich, immunoglobulin-rich substance that provides vital immunity to the newborn during the first few days of life. Hormones are responsible for control of milk production and ejection. Prolactin stimulates milk production in the alveoli. Oxytocin triggers the ejection of milk from the alveoli through the ducts and out of the nipple. Understanding and correctly using similar medical terms is essential in healthcare communication. Let's differentiate some terms related to the breast and lactation. For areola and areolar. Areola is a noun referring to the pigmented area surrounding the nipple. Areolar is an adjective describing something related to the areola, such as areolar tissue or pigmentation. For lactation, lactate, and lactiferous. Lactation is a noun meaning the production and release of milk by the breast. Lactate is a verb meaning to produce milk, as in the mother begins to lactate after childbirth. Lactiferous is an adjective referring to the process of lactation, such as lactiferous ducts, which transport milk to the nipple. The breast can be affected by various conditions, ranging from benign disorders to serious malignancies. Let's explore some key terms and conditions. Mastitis refers to inflammation of the breast, often caused by infection, particularly during breastfeeding. Mastalgia describes breast pain, which may occur due to hormonal changes, trauma, or other underlying conditions. Fibroadenomas is a small, benign, solid, or cystic tumors that can be surgically removed if necessary. Fibrocystic disease affects 60% of women and presents as lumpy or painful breasts, often detected through mammography. Nipple discharge may indicate underlying cancer and should be evaluated promptly. Galactorrhea is the production of breast milk in the absence of breastfeeding, which may result from certain drugs or a pituitary tumor. Gynecomastia refers to the enlargement of breast tissue, which can occur in one or both breasts and affects both men and women. It may be a side effect of medications or related to hormonal imbalances. Breast cancer is diagnosed through breast self-examination and mammography. Breast cancer remains a significant health concern. Treatment includes surgical removal of a lump, section, or the entire breast, with or without lymph node removal, as well as chemotherapy and radiation therapy. Paget disease of the nipple is a rare condition that is often indicative of underlying cancer and requires immediate evaluation. It typically presents as eczema-like changes on the nipple, such as redness, flaking, or crusting, as well as itching or burning sensations around the nipple. Genetics play a significant role in breast cancer risk. Let's discuss two critical breast cancer genes. BRCA1 is a gene associated with an increased risk of breast and ovarian cancer. Mutations in this gene can significantly elevate an individual's likelihood of developing these cancers. BRCA2 is another gene linked to breast cancer, with mutations also increasing the risk of ovarian cancer and certain other cancers, such as pancreatic cancer. Let's discuss the procedures and pharmacology of the breast. Diagnosing and treating breast conditions involves a variety of procedures tailored to the individual's needs. Let's explore the key diagnostic and therapeutic procedures for the breast. Diagnostic procedures are used to examine the health of the breast tissue. Breast self-examination is recommended on a monthly basis. It helps individuals detect any unusual lumps or changes early. Mammogram provides either 2D or 3D images of the breast, often enhanced by ultrasound, for detecting abnormalities. Stereotactic biopsy is a minimally invasive needle biopsy performed during mammography to sample suspicious tissue. Staging is performed in cases of breast cancer to determine tumor size, lymph node status in the axilla, and evidence of metastatic spread to other parts of the body. Therapeutic procedures are used to treat breast pathology. Lumpectomy is a breast-conserving procedure that removes only specific areas of concern, preserving the rest of the breast. Mastectomy is the complete removal of the entire breast, often recommended for more advanced cases of breast cancer. Radiation therapy uses high-energy rays to target and destroy cancer cells, often as part of a comprehensive treatment plan. Chemotherapy and targeted therapies play a vital role in the treatment of breast cancer and other breast disorders. Let's discuss the types of chemotherapy and associated treatments. Chemotherapy is a systemic therapy that travels through the bloodstream to target and destroy cancer cells throughout the body. Often involves the use of multiple drugs in combination to improve effectiveness and reduce the likelihood of resistance. In 2019, the FDA approved the first immunotherapy treatment for breast cancer, marking a significant milestone in treatment advancements. Selective estrogen receptor modulators, as these medications block estrogen from attaching to the estrogen receptors on ER-positive breast cancer cells, slowing or stopping their growth. Herceptin, or trastuzumab, is another targeted therapy specifically for breast cancer cells that produce excessive HER2 protein. It blocks the overproduction, helping to control the growth of these aggressive cancer cells.